to my channel. My name is Jennifer. So today's video I'll be talking about things you should do when you have a toothache. Now, if you've ever experienced a toothache, you'd agree with me that the pain is excruciating. Anybody who has experienced it wouldn't want to ever experience it again. So today I'm here to tell you what to do when you have a toothache. Now, as cliche as it may sound, the first thing you should do when you have a toothache is to visit a dentist. Yes, most of the time in our environment, people first go to patent drug sellers, buy drug from the roadside, painkillers and all of that. The truth is that when you get these painkillers, they can only numb out the pain for a while, right? They are not solving the problem. They are not tackling the problem from its source, from its origin. They are just like numbing the pain. So for the time frame that you're taking the drugs, you'd probably not feel the pain, but as soon as you stop taking the drug, the pain will come back. So the pain that you're not feeling the pain doesn't mean that whatever it is that is causing the toothache isn't there anymore. It just means that you're not feeling the pain. So the most appropriate thing for you to do is to visit the dentist, because some people think that the moment they stop feeling the pain, the problem has been solved. No, you're only prolonging the problem and making it more complex and complicated. So the first thing you should do is to visit a dentist. Now, what happens when you visit a dentist? When you visit a dentist, the dentist is going to ask you a number of questions. These questions will give the dentist an idea on what exactly is the cause of the toothache, right? So depending on the type of pain you feel, depending on the time of the day you feel the pain, depending on the intensity, whether there is variation over the day, it gives a whole idea. And then other investigations are going to be done in order to ascertain the cause of this pain. Even the duration of the pain also gives an idea on what the cause of the pain is, and appropriate treatment will be given to you. Now, what are the things you should not do when you're having a toothache? Do not try to yank out your teeth by yourself. The worst thing you can do is trying to pull your tooth out by yourself, because when you do that, you could fracture the tooth, you could damage your bone, the bone in which the tooth is embedded in. You could even come down with an infection that would worsen your situation, make you feel more pain. What have I seen people do? People grind painkillers and place in those areas, and then they come back with burns in their mouth, because those drugs are not meant to be placed on the surface of your mouth. Especially the mouth has very sensitive tissues, so you're not supposed to place those drugs there. The drugs are made in that formulation for you to swallow. If it's a tablet, you're supposed to swallow it. If you get the drug that is supposed to be swallowed and then you decide to grind it and put it on the surface because you think it's going to be more effective, you'll be causing more harm to yourself and damaging those tissues around that place. So please do not do that. And then people believe that once they visit a dentist, the next option is to pull their tooth. As a matter of fact, tooth extraction is usually the last option, the last resort. Most times when people are given this option is because probably they cannot afford the other treatment modalities or the other treatment options that are available, of which if you had presented as early as you start feeling the pain, this would have been taken care of. And I would also suggest that you come to the hospital as soon as or as early as you start feeling the pain, because the pain of toothache, it doesn't stop. It only gets worse over time. There are no drugs that cure toothache. The only cure to a toothache is for you to visit the dentist, and then the dentist is going to look at you, find out why you're having a toothache, and then tell you what he or she is going to do for you to solve the problem. If you have a hole in your tooth, you have to fill up the hole. If you have a pulpal involvement, they have to do a root canal for you. If you have a cyst or any other pathology going on there, they'll be taken care of appropriately. But there are no drugs that cure toothache. So if you have this in your mind, you would understand that the best bet you have is actually visit a dentist so that he or she can give you proper medical attention. The longer you wait, the more the pain, the more severe the intensity of the pain, and the more chances of you spending more money in the hospital than you would have spent if you visited the dentist as early as you noticed the pain. I'd also like to reiterate, taking painkillers does not solve the problem. In fact, it will get to a point where the pain wouldn't respond to the painkillers anymore. Like, you hear people say things like, I've been taking this drug, but after a while, the pain just came back, and it came back worse. It's because the drug is not solving the problem, and the drug is just numbing your sensation to the pain. The cause of the pain is still there. Whatever process that is causing that pain is still ongoing. You're just not feeling it. Whenever the drug wears out or wears off, you begin to feel the pain all over, because whatever it is that is causing the pain is still there. So that's why painkillers will not solve the problem. Thank you so much for listening. If you have any questions, then leave it in the comment section or send it to my email. I'll respond to all of your questions and your concerns. If you found this video helpful, please like, comment, and share. See you guys in the next video. I love you all.